Today I'm going to be interviewing Dr. Paul today, and I really appreciate him for taking time out to come up with this interview and help me with answering all my questions with cancer. So this is Dr. Paul.
Hi, I'm Paul Church. I'm one of the specialist registrars in the haematology team at University College London Hospital. So I look after patients with lymphoma on a daily basis, and I also work in medical research for patients with lymphoma.
Thank you very much. Today's first question I wanted to know about is what are the first signs of any type of cancer?
Okay, so I guess it depends on what kind of cancer it is. So for lymphoma, the symptoms that people typically present with are swelling of lymph nodes. So that means that glands sometimes in your neck or in other places in your body, like your groin or inside. And sometimes people also get other symptoms like fevers or sweats, where they get very sweaty at night time, or losing weight. People can have a whole load of different other symptoms, but those are the most common ones. Lymphomas are reasonably rare cancer. There are some groups of people where it's more common, like people in their 20s and things. If you talk about cancer in general, then more common cancers like lung cancer or breast cancer, you present with symptoms related to like cough or lung cancer, or lump in the breast or breast cancer, or bowel cancer, presenting with kind of change in your bowel habit, that sort of thing.
Okay, I see. Thank you very much. And the second question is anxiety a cause of any type of cancer?
We don't know that anxiety is a cause of cancer.
Can lymphoma be cause of any type of pressure by family or worry? Family pressure?
I think a diagnosis of cancer puts an awful lot of stress on a family. So it's not just the person who has the cancer, but the whole family. So people are ill, and that's very difficult for a family to deal with. They're taken out of doing their normal things and using what their role is. There can be financial worries for families. There can be worries about what this means for the health of other members of the family, difficulty getting in for treatment, and it can take a real stress for a whole family rather than just the person who has the condition.
Okay, thank you very much. And what are the types of different stages of any type of cancer?
Okay, so again, this is a bit different for lymphoma and for most types of cancer. So for most types of cancer, like breast cancer or bowel cancer and things, we talk about whether it's locally, just one lump that's in the place, or whether it's spread through lymph nodes, or whether it's spread somewhere else in the body. And that's kind of when we talk about stages of those kinds of cancer. It's different for different kinds of cancer. And with most kinds of cancer, not all, once it's spread away from the place that it started, generally it's very difficult to cure.
Okay.
So for lymphoma, it's a bit different. Lymphoma, we have a different called staging system, where we have, if you've got one set of lumps that are just one place, then that's a stage 1 cancer. If you've got two sets of lumps, but they're on the same sort of area of the body, above or below the diaphragm, it's called, which is the bit here which helps breathe, that's stage 2. If they're on both sides of the diaphragm, that's stage 3, and if it's somewhere else, not in a lymph node, like in your liver or somewhere like that, then that's stage 4. But we can potentially, depending on the kind of lymphoma, you can look at curative treatments even if you've got an advanced stage lymphoma. Okay. And then we also talk about A and B, that there are people have got. If you've got B symptoms, which are things I mentioned before, like fevers and weight loss and night sweats. So we give it a number plus a letter, A or B.
Okay. So as there's 4 stages of lymphoma cancer, are there any chance of going back from a stage 4? Have you ever experienced with any patients or anyone who were on stage 4 of lymphoma cancer and survived from it?
Yeah, so for lymphoma, It's depending what, there's lots of different types of lymphoma, was the first thing to say. And often even if you have got an advanced stage cancer, even with stage 4, depending on the particular kind of tumour, then we are still looking at giving people treatments to cure their disease. So getting rid of the disease even though it's stage 4.
Okay, thank you. What are the possibility side effects of any type of cancer treatments you do?
Okay, so the main treatment which we use for most cancers, but particularly for lymphoma, is we give chemotherapy. So that's something called cytotoxic chemotherapy, and what that means is that's drugs which kill lymphoma cells. Now they also have effect on other normal cells in the body. With cancer cells, they're growing fast, so they're replicating themselves and doubling fast. So typically the side effects that you see are because these kind of drugs affect other cells which are doubling fast. So like your hair, for example, your hair's growing all the time, so that's why people's hair often falls out with chemotherapy treatment. And you can get things like mouth ulcers and things because the lining of your stomach and your whole gut and your mouth, that is all changing over very fast as well. And then the other main symptom which I guess people get is of nausea and sickness, and we give lots of medicines to try and stop that from happening, and that's because the chemotherapy drugs interfere with that part of your brain. We also give some other treatments. Sometimes we give radiotherapy, which is like X-ray treatment for a localized area of lymphoma, which can have direct side effects to where that's happened, depending on where it is in your body. And sometimes we also give things like antibody treatments, which are slightly different from chemotherapy, which are specifically targeted against the lymphoma itself. Don't have the same side effects as chemotherapy, but sometimes people would have things like allergic reactions to them.
Okay, that's fine.
We don't really use surgery, like for a lung cancer or something. We don't really have surgery as a treatment, which we do in lymphoma.
Would you have that type of surgery probably in the future? Are you working on that?
So surgery doesn't really work for lymphoma. That's why we don't do surgery, because of the way that it works. Even if you cut the bit out, then it will be somewhere else in the body.
Okay,
so it doesn't really help to cut it out. So we don't do it because it's not a helpful treatment. We have to do it.
Thank you very much. And are there any herbal treatments for cancer? Like, are they more effective? Have you ever tried any herbal treatments like cannabis oil or that's what I've done research about. Some cannabis oil is quite good for any type of cancer.
So we kind of look in medicine, we kind of look at evidence to say that treatments work. So if you look at lots of different things for all sorts of different conditions, you can have people who typically sell that product will say that it works very well. But what we like to see is a trial where we treat people with it and we follow them in a sort of scientific fashion and see if it works. And I'm not aware of any herbal treatments or anything like cannabis oil which is effective against any kind of cancer, actually, really, not just lymphoma. Now, that's not to say that there's not a place for alternative or complementary therapies, like for symptom relief, perhaps. Like people can come out to get quite a lot of benefit from different drugs, like people have got pains or anxiety issues, perhaps, and sometimes that sort of thing can be helpful. But I don't think at the moment anyone would suggest that they could be replacements for kind of traditional treatments for cancers.
Does every patient lose their hair with cancer, or is it not?
It depends on what treatment we're giving. So if people are having chemotherapy with the drugs we talked about before, the majority of people with lymphoma probably will. There are some people we don't treat with chemotherapy, or we treat with very light doses of chemotherapy, or with some newer drugs which aren't chemotherapy and they don't have hair loss. And different types of chemotherapy will have different chances of making your hair fall out. So, for example, people who are having breast cancer chemotherapy, maybe half of them will have hair loss. People having lymphoma chemotherapy, depending again what kind of lymphoma it is, probably almost all of them will have hair loss.
Thank you very much. How do you as a doctor come across telling your patient that they have cancer and they might die from it?
I think it's difficult. It's one of the challenges of being a doctor. I think what's important is that is how that's kind of done. So often people, when they come to see us, come to see me, I'm not usually the first doctor that they've seen. Usually they've seen, because they have to be referred to us from someone else. So usually they know, or at least have an inkling that you know they've probably got lymphoma because they're coming to a lymphoma clinic usually. But I do find myself telling people sometimes this is the case. I think you have to do it in a supportive way. It's helpful if they've got a family member or someone else with them. It's helpful if they've got not just a doctor, but they've also got one of our specialist nurses in there. And we try to not give too much information the first time that we tell people, because people automatically want to ask a lot of questions, but won't probably be able to take a lot of it in once they've heard the bad news. So it's about an initial time when you talk to people about it, and then making sure there's another time to follow up and giving some information to take away, and then coming back again to go through the whole process. And it can be difficult, like emotionally for doctors doing it, but it's part of what we're trained to do, and we have to deal with it.
Do you have any weaknesses as a doctor and some strengths?
Okay. So, my weaknesses and strengths as a doctor. I think that I'm quite good at knowing what's all of, having quite a good grasp of things like all the trials and things that are going on, and what probably the best treatment is for people. I think sometimes, as you talk about, there's lots of other things that you've got to think about for patients, and whether that's what's best for them and the difficulties of their family. And I think sometimes I could probably be more, like with most doctors, we could probably think about that a bit more. We try and do that as part of the whole team, and that's particularly why we also have specialist nurses and things who are think about that stuff sometimes more than the doctors do, who are sometimes quite focused on the trying to treatment, as it were, around the whole thing. So I think that's something I could certainly kind of work on.
Okay, thank you very much. What challenges do you as a doctor come across with?
With looking at patients with lymphoma?
Lymphoma.
Well, so...
Or any type of cancer.
Yeah, we can have lots of different challenges. Challenges can be knowing what's the right treatment for somebody. There's not always a one-size-fits-all kind of thing. We have to have that discussion with families, or with patients, and their families. I think it's a challenge when things don't work or things go wrong in some way. That's a challenge, and knowing what to do next and how to go around doing that. I think we have challenges with kind of resources. So being able to see and do everything as quickly as we would like it to be done. So for example, if we can't get a scan because there are no scan slots for a week or two, then that can be very stressful for a patient. We usually manage to do things quickly if we need to, but it can be difficult. I think other challenges are around if you have kind of managing expectations. Sometimes we have patients that we know that we can't cure. Sometimes, and that could be a difficult situation. Is what's the best thing for people to have for their quality of life.
Do you ever get emotionally attached to any of your patients you treat?
So we look after people for quite a long time, often for a number of years. So we, obviously we have an emotional connection with patients, and some more than others. Some you'll have more of a personal relationship than others. I think one of the challenges as a doctor, as any healthcare professional, is keeping making sure you're on the proper kind of side of that. So yes, we are emotionally invested in them, but not in the same way that members of their family. We're not same as members of family or friends, or it's a different relationship.
Yeah.
So it's a difficult question to answer. I mean, obviously, yes, we are, but not in the same way that
The family are.
Yeah.
Thank you very much. Have you ever felt like you have failed in yourself in any treatments?
I think there are times when we have, in retrospect, made the wrong decision for somebody. So, so an example for that would be if you have somebody who is quite elderly and you're not sure if they're going to be able to be fit enough to take the treatment.
Yeah.
But you think, well, perhaps they will, and you want to give them the best chance of getting cured, and then they don't. They do very, very badly, and it really impairs quality of life. That doesn't mean to say that your decision was wrong up front, but it feels like that.
Okay. Yeah.
Because we tend to discuss everything as a team.
Yeah.
We go through what's called a multidisciplinary team. So it's not just one doctor who decides what you're going to do for you. It's a team.
Yeah.
And in discussion, obviously, with the patient and family. And usually that means that we've made what we think is the right decision up front, and we wouldn't go back and change it.
Yeah.
And it wasn't expected that you wouldn't necessarily choose differently if you had it again, but it turned out to be the wrong thing.
Yeah.
Does that make sense? You had to, or sometimes if you've got choice between two treatments, one of them's more intensive, one of them's less intensive, and then you choose what turns out to be the wrong one, either because the cancer comes back or because the patient's not able to tolerate the treatment.
Yeah.
So that's times, I think, I would say, when that's hard. And of course there are also times when you have somebody young with a family and you can't cure them, and you feel like you've failed them, of course, but there isn't anything else that we could have done, but it still feels like a failure.
Thank you very much for your lovely answer. What's the worst case that you have ever faced with a patient or any treatment?
I think that's difficult. I don't really have an answer for that. I think what's hard in our specialty of hematology is that we quite often deal with quite young people, and it can be really, really terrible if somebody young, so even so adolescents and teenagers sometimes, they're often the worst cases that you can think of, because the whole family is invested in it. People feel that it's very unnatural that the child is the one that's ill when it should be even the grandparents. And I think there have been cases like that when everything that we've done, the cancer has still come back, for example, or times when the cancer has gone away, but as a result of something, as a result of the treatment, something bad's happened to the patient. I think they're the worst cases. But I wouldn't think of a specific one that I would say is the worst case that I've ever been involved with. But,
Thank you very much. Which age groups suffer from cancer mostly, and which genders also?
So, in general, cancer gets more common the older you get. So for most cancers, they'll have peaks in certain age groups, but in general, they'll go up as you get older. For lymphoma, that's generally the case as well. For some kinds of lymphoma, like Hodgkin's lymphoma, that's most common in people between sort of about 15 and 35, and then gets common again as you get older. Different cancers have got different male and female preponderance. So with most lymphomas, they're reasonably equal. Some are a bit more men, some are a bit more women. It just depends on the one. Overall, I think men are slightly higher risk of cancer, but basically very similar, because it sort of evens out. Obviously, there's not very many men get breast cancer, women get breast cancer. There's no women that get prostate cancer, and men get prostate cancer. So overall, very slightly higher in men, I think.
Okay, so thank you very much for your answer. What happens if the cancer gets treated, and is there any possibility later in life it comes back?
Can. Again, depends on the cancer. So there are some kinds of cancer which we know that you have got a chance of it coming back for the rest of your life.
Okay.
There are some kinds of cancer where if you're free of the cancer about a year afterwards, you're very unlikely that the cancer is going to come back, and it just completely depends on the different kinds of cancer. So for even some kinds of lymphoma, we know that they're a lifelong risk, and some kinds of lymphoma, we know that they're very unlikely to come back once you've got rid of them. One other thing is that anyone who's had one cancer in the past has got a higher risk of having a different kind of cancer in the future. Either as a result of the treatment that you've given them, which make them be slightly higher risk of cancer in the future, or because of some other thing. So.
Thank you very much. So, as a doctor, what would you suggest the family? What type of support can you give a cancer patient?
Support. So I think with any family that are going through a difficult emotional time like that, then I think there's going to be a lot of emotional support required, and that family can be really important for that. I think obviously there can be support with doing the things that they would normally be doing. So people often would be coming for their treatment, for appointments, and looking at how you support them doing that, looking at how you support them doing whatever task it is that they do, because it's going to be difficult for most people to just do their completely normal life as well as having their cancer treatment. I think probably the most important thing, depending on your family, is sort of being there for them, being able to help in the way that they want to be helped.
Because I think I remember that when my mother had lymphoma cancer, doctors did say that you'll bring your children more often and surround her as happiness, and she'll get happy like whenever there's any festivals come around. So we did go visit her when it was Eid, and bought food and stuff. Family came around as well. And I think at one point my dad was planning to take her to Pakistan to see her family, and because if she's in a different environment, you never know, like she might be more happier, and might forget about what she has in her. So but we didn't get the chance to take her. So,
it's often difficult.
Because I think the doctors found out that when she was transferred from Luton L&D Hospital to UCL, she was on stage 3, but coming on to stage 4, so there wasn't any chance for her to go out anyway. So, thank you very much for your answer. Is gene therapy effective on cancer?
So there's not really anything to say that gene therapy, as in changing the genes of a cancer, kind of works. For lymphoma, the thing which has been kind of some excitement recently is that something called cell therapy, which is a bit like gene therapy. So that means taking the immune cells out of the patient and then re-educating them in the lab to go and fight the cancer and putting them back in. So that's something called CAR T cells, or chimeric antigen receptor T cells. And in lymphoma in the past few years, they've shown some quite striking results of getting rid of cancers, even in people with quite advanced tumours. And they've just recently been approved to be used in this country. So that's really about the only kind of cancer therapy in terms of gene therapy that there is at the moment.
Thank you very much. What sort of treatments do you have for lymphoma cancer, and how successful is it with lymphoma cancer treatments?
Okay, so it depends on what kind of cancer you've got as to whether we can, what kind of lymphoma you've got, and what kind of stage it is and things as to how likely it is to be cured. For the most common kind of lymphoma, which is called diffuse large B-cell lymphoma, we would say overall we probably cure about 60 to 70% of people that come to us, but that will vary a lot depending on what they're like. And the most common treatment which we use is chemotherapy coupled with antibody therapy. We have other kind of treatments sometimes, like radiotherapy or different types of chemotherapy that's come back. Sometimes we do things called bone marrow transplants.
Never heard of that.
So bone marrow transplant is when we give you a very high dose of chemotherapy, which would normally be enough to sort of wipe out your bone marrow such that you couldn't make normal bone marrow cells.
Okay, I see.
So it would be fatal if you didn't give a bone marrow transplant. So that means taking what are called stem cells, cells that grow into blood cells, from either yourself, from either the patient himself, which is harvested before the chemotherapy, or from somebody else, like a brother or sister, and put them back in. So you wipe out the whole bone marrow, hopefully the cancer as well, and then you have to repopulate the bone marrow with these stem cells.
Okay, I see.
So that's a bone marrow transplant. And if you see Anthony Nolan or something like that, looking for donors for bone marrow registries, that's what that is. So you can sometimes donate to somebody else that you're not related to.
Okay, I see. I think when my mother was on her last stage, I think one of the doctors did suggest that, but I wasn't sure what it was exactly called.
So if people get into a cancer, like a lymphoma, which is very difficult to treat, and has come back lots of times, has been resistant, then usually once you've got to that stage, the only thing we can do to cure you is to have a bone marrow transplant from somebody else, if we can. But sometimes people are too sick for us to be able to do that, or the cancer is too aggressive for us to be able to do this.
Thank you very much. And what is the life expectancy of lymphoma cancer?
So again, it depends on what you've got. So there are some kinds of lymphoma that you can live with for a lot of years. So people can have them for 20 or 30 years, and it never completely goes away, but it doesn't cause them any problems. Whereas down to the other scale, there are some cancers which are so aggressive that if we didn't treat them, people would die from them within a couple of weeks, but are relatively easy to cure. So there's not a really simple answer for that. We hope to cure the majority of people who've got lymphoma, but there are some that we can't. So it's a thing which it depends on the person and what kind of cancer they've got.
Thank you very much for your answer, and thank you so much for taking out time today to do my little interview. Really appreciate it. Thank you very much.